İsrail'de Delta varyantının etkisiyle Covid-19 salgını yeniden yayılıyor. Salgının hızla yayılması nedeniyle sağlık sektörü üzerindeki yük giderek artıyor. İsrail yönetimi ise 3. doz aşıyla salgının önüne geçmeye çalışıyor.
I think we're seeing a penetrance of the Delta strain, the Zon Delta, we say, there is an increase in these patients, whether it's 7,000 or 8,000 a day. But what we're not seeing, at least here, is the increase in severe cases like we saw in the first 3 waves. And I believe that's because of a lot of things: the rapid diagnostics, certainly people being in appropriate situations where they're hand washing and they're wearing masks, but also vaccinated. I think the majority of patients that we're seeing in the hospital in critical condition, severe condition, are those who primarily are not vaccinated. I think in some patients we are seeing a waxing and a waning of immunity. I think like flu, which is quadrivalent, it's got 4 strains in it, and has a 60% efficacy. We get that every year. I think that's important. I think I look at the booster as going to be our annual flu shot equivalent. In terms of the timing, I think we're learning. In terms of what strains we want to include in that booster, I think we're learning. We have a number of companies that are working on appropriate vaccines and appropriate vaccine preparations, including some working on pills and other models of administration. But I think it is important, not necessarily to prevent shedding, but to prevent severe disease. And I recommend it. The timing, again, the present recommendation is 8 to 9 months after the primary dose. And certainly, if someone is high risk, such as cancer patients, autoimmune disease, on immunosuppressant drugs, patients like that. Right. So I appreciate being intellectually honest. I'm an epidemiologist. I look at numbers. I look at the facts. I'm a physician. I treat patients in the community, in the hospital. I think vaccination is important. I think a preventative strategy is important in terms of including rapid diagnostics and vaccines. I think we're learning about vaccine and the vaccine response, what to do with immunoglobulins and the immune response. But I think it's important. The number of vaccines, the type of vaccine, I think we're learning. I think, in a few years, we might have gone through a few different iterations of vaccine. At first, I think we're thinking about herd immunity and creating herd immunity and preventing shedding. I don't think we're seeing that as much as we are preventing severe illness. And that's important. I think that's probably more important. It's not that getting a headache or getting GI symptoms or weakness is not important, but arriving to an ICU on high flow oxygen or becoming intubated or, God forbid, dying, that's really what we want to prevent as well. It's an excellent question. For the most part, and I think we're seeing this around the country, it's an epidemic of the unvaccinated. People who are not vaccinated. We're seeing this in patients with past medical history, significant for these diseases like cancer, immunosuppression. But we're also seeing in patients without underlying disease or have not been, as of yet, diagnosed with underlying disease. So that by far, in a way, the majority of these patients who are arriving on high flow oxygen, getting prone, meaning we put them on their belly to try and increase their oxygenation, and intubated are those who are not vaccinated.